Corrective exercise specialists and physical therapists need to establish a baseline for their clients and their patients. Initial screenings typically involve a forward lunge, which aids in the discovery of muscle imbalances that are used for injury prevention and maintenance. The lunge is also used as a warm-up and strengthening exercise for those who want to exercise their lower extremities. Given that the lunge can be used in a variety of circumstances, it is important to establish what is really going on physically in the body during a lunge. For simplification purposes, I have broken down the movement into 3 phases, so let's check them out. I came to dance, 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 dance. I hit the floor 'cause that's my place. The initial phase consists of the forward step that prepares the client or patient for the downward phase of the lunge. To begin this phase, one of the legs will move forward from neutral standing position while leaving the opposite leg behind. Due to the open kinematic chain, as the lower extremity is propelled forward, the hip flexors are acting as prime movers. As a result, the leg that moves forward will bear weight on the ground, creating a closed chain. Both the acetabulo-femoral joint and the tibiofemoral joints, we have flexion. At the talocrural joint, we have the client experiencing a plantar flexion. The Examination of Orthopedic and Athletic Injuries book states that after this motion occurs, the leg's active muscles begin eccentrically contracting. According to the text, active muscles include the dorsiflexors and quadriceps group. Other active muscles involve the hip adductors and the plantar flexors, with the hamstrings isometrically stabilizing, and the gluteus maximus working to concentrically contract and extend the hip on the right leg, while unilaterally and eccentrically decelerating the left leg side. The downward phase consists of the lowering of the body weight until the knee is almost at ground height. Nassum describes eccentric motion as moving in the same direction as resistance is moving. The muscles in this movement are eccentrically moving as they move downward with resistance. At the acetabulo-femoral joint, the movement can be described as performing flexion. Brunstrom claims normal unilateral hip flexion with the knee, flexed, occurs until anterior thigh contacts the trunk. At the knee or tibiofemoral joint, the client is experiencing that said flexion. Due to the closed chain, the right leg is experiencing the femur rolling backward and gliding forward on the tibia. At the talocrural joint, they are experiencing dorsiflexion. The upward phase consists of elevating the body weight to return to neutral position. NASM describes concentric motion as moving in the opposite direction of force. The active muscles in this movement are concentrically moving as they accelerate upward and produce force. As this upward motion occurs, the quadriceps group becomes concentrically activated. According to Brunstrom, the gluteus maximus can activate as well, in the event that the hip experiences a powerful hip extension from the previous state of weight-bearing hip flexion. Due to the closed chain, the right leg is experiencing a femur rolling forward and gliding forward on the tibia. At the acetabulo-femoral joint, extension is occurring, while at the tibiofemoral joint, the client is experiencing knee extension. Due to the closed chain, the right leg's femur is rolling forward and gliding backward on the tibia. At the talocrural joint, the patient is experiencing plantar flexion. Brunstrom's clinical kinesiology text discusses that the knee plays a primary role in lowering and elevating body weight. Because the tibiofemoral joint is made of 2 long lever arms, known as the femur and the tibia bones, it is at a higher risk for injury. The lunge specifically causes a large enough torque to this joint that may cause pain to the patient's or the client's knee region.